dermatologist. You guys work with dermatology. They're very well trained. They're medical doctors. They do long residencies. Like most of us, they've put in a lot of time.
Right.
They're very good at what they do, especially detecting skin cancer early, treating it. I'm sure you've had people with various type of skin cancers, whether melanoma, squamous cell, basal cell, and others. And so you guys work readily with them, right? And you share patients at times.
Yes.
Right?
Commonly.
So how does that relationship in the new era, how should that be? How
it's interesting. Dermatologists used to be the plastic surgeon's best friend because they didn't really overlap into the aesthetic aspect of the industry. And so they would be a source of referral for a plastic surgeon.
Right.
And so obviously, selfishly, you want that source of referral. Now, a lot of dermatologists perform injections, and I would not say across the board that no dermatologist should inject. But I think people need to understand what their training is. They're not surgically trained.
Right.
Outside of Mohs surgery.
In Mohs surgeries,
In
right.
Mohs surgery, and even so, that's a very...
in Mohs surgery?
It's she's the expert.
So Mohs surgery is an approach to skin cancer where it's meant to minimize the amount of tissue that you take away and the defect that you create. And so it's indicated for skin cancers that are in cosmetically sensitive areas. Like, so for example, like the lower lid, very, very sensitive area to operate on because you affect the eye and exposure of the eyeball, et cetera. So if you have a skin cancer here, you'll go to a Mohs surgeon. So if you go to a traditional, person to cut out that skin cancer, they have a set margin that they just cut out around the skin cancer. And they're like, that's the margin we need for this diagnosis.
Right.
And we close it up. And they don't care about the defect that's created.
Got it.
When every millimeter counts, you go to a Mohs surgeon and they basically minimize the margins and they take that tissue, they take it to the back room, they put it under a microscope, and they actually look at the cells and they just cut minimal amounts until they have a clear margin on microscope.
Wow.
And so you're minimizing the amount of the defect that you
The
have.
scar, yeah.
So most surgeons are trained in surgery, but even so, they're trained in, like surface surgery, right? Dermatologists are not trained surgeons. And so basically it's just different. Knowing the surgical anatomy of a face is very different. Being intimately aware of the different layers and having operated on them and, perform facelifts and like eyelid surgery, it's different from somebody who's basically just trained in skin. And so I know that there are fabulous, wonderful injectors that are dermatologists.
Right.
It is, however, a slippery slope because just yesterday I was made aware by some colleagues in plastic surgery of a dermatologist who is performing body contouring procedures.
Right.
And
so is that fat transfer stuff or
mostly they were advertising
liposuctions?
liposuction.
Right.
Liposuction, like tummy tucks, that sort of a thing. And then there was like this big fight that broke out like on this Instagram post where all these people were saying, how dare you criticize him? He's fellowship trained in cosmetic surgery. So this raises the question, nobody actually understands training and what sort of training actually makes you capable of performing plastic surgery procedures. So he had all these followers who said he's a legitimate, plastic surgeon because he did a cosmetic fellowship. Well, what they don't understand is there's no legitimate fellowship that is plastic surgery training for a dermatologist.
Right.
You can pay somebody, not be accepted on merit.
Right.
Or the fact that you already had a surgical training and understand anatomy. You can go to
a course, right?
A course.
For a weekend or a week-long course.
To be honest with you, some of these are a year long. And
Right,
you pay a plastic surgeon to go into their operating room and watch them operate for a year. But how would you like the person who you're trusting with your surgery that you're putting a lot of your time and your investment in your recovery into?
And money too.
Yes, absolutely. Your
Not cheap.
finances, your time, and then you find out that this person did a skin residency and then went and paid somebody to watch them for a year.
To follow them.
And then that's how they learn surgery.
Right.